what do you think are the lessons that you've learned in practicing in both settings?
The lessons that I've learned in practicing in both settings is that um, I think I, we are just a very valuable member of the healthcare team.
Mm-hmm.
Um, your role as a physical therapist, actually, here in the United States, I really felt our value as a physical therapist. You are really the movement expert here.
Mm-hmm.
Um, you are the mobility expert. So our job is very, very much appreciated.
Right.
And I've learned to become more critical in my clinical thinking skills, in my
Mm-hmm.
clinical decision making skills, because
Mm-hmm.
um, technically you are a doctor actually, so you are
Mm-hmm.
on your own. You
Mm-hmm.
have you have your own you have your own set of practice.
Right.
You have your own boundaries within your practice.
You have
No
your own
one will
scope.
tell you. Mhm, you have your own scope. No one will tell you do only passive range. No one
Mm-hmm.
will tell you that. Although they can tell you at times, but most of the time, no one. So
Mm-hmm.
you will have to do your best clinical judgment in here. In the outpatient, for instance, let's say I have a vestibular case.
Mm-hmm.
Is it really a BPPV,
Mm-hmm.
or is it really like a central lesion or
Central.
something
Mm-hmm.
like that, or
Mm-hmm.
like a vestibular issue as a result of ototoxicity, something like
Mm-hmm.
that,
Mm-hmm.
or you're having vestibular issues because you've just had a recent infection,
Mm-hmm.
something like that. So you got to figure out where the issue is really coming from.
Mm-hmm.
You know, something like so. I really like the main lesson that I've really learned here is that you really have to be very diligent in
Mm-hmm.
your clinical decision making skills,
Mm-hmm.
because you're an uh, independent member of the healthcare team, independent and codependent at the same time, because
Right.
it's the rehabilitation team, so you have to there will come a time that you have to talk to the other members of the healthcare team,
Mm-hmm.
even outside the hospital setting or outside the clinic,
Mm-hmm.
such that I have to contact the orthotist. Sometimes I even have to talk to the case manager.
Right.
Let's say
Right.
for instance in the acute care. So in the acute care, your role there as a physical therapist is to really see where this patient will go after being discharged from the hospital.
Mm-hmm.
So will the patient benefit from an inpatient rehab? Will the patient benefit from a skilled nursing? Other
Mm-hmm.
than preventing the impairments of long-term hospitalization, long-term effects of immobility,
Mm-hmm.
your role in the discharge planning is very significant. You are not the one who will tell the patient when to be discharged from the
Right.
hospital, because that's the doctor's job or the physician's job.
Right.
But to where to send the patient after being discharged is one of your roles there. You have to tell the case manager